Welcome to the Covenant Metabolic and Bariatrics Center, a fully accredited Level 1 bariatric center dedicated to understanding obesity and helping patients with weight loss through diet, medicine, and proven surgical procedures. The purpose of this video is to introduce you to surgical procedures that can literally change your life. Each operation has its own merits, potential side effects, and it will ultimately be up to you to decide which is right for you. The main thing is for you to do research as much as you can before making a choice. And we here at Covenant are here to help you make an informed decision as to what's right for you. Obesity is a life-threatening disease affecting almost 36% of the United States population. The prevalence in men and women is almost equal, and we know childhood obesity is becoming more and more of a problem as we see the children are becoming obese at a younger age. Over the last decade, we have doubled the population with a body mass index of 40 or greater. We know obesity is a disease, we know it's an illness, and there are environmental and psychological issues that come along with it as well. Did you know obese individuals spend 42% more on healthcare each year and almost 80% on medications more than someone with a normal BMI or normal weight? Obesity costs a lot of money. Just what is BMI? It means body mass index. It's based on a standard from the National Institutes of Health, and it takes into consideration your weight and height to determine your body surface area. A BMI of 18 to 25 is a normal weight, 25 to 30 is overweight, 30 to 35 is obese, 35 to 40 is severely obese, and any BMI greater than 40 is considered morbidly obese. Weight loss strategies traditionally have focused on diet and exercise. Diets are prone to failure because it's almost impossible for someone to continue a strict diet for the rest of their life. Physical activity is important, but it doesn't always lead to the weight loss in the amount that you need. Weight loss surgery is the most effective approach for significant long-term weight loss, and we know through randomized prospective trials that it is the only method for sustained weight loss. Diet and drugs can't do that. In the past, obesity was seen as a weakness or a failure on the individual's part. We know that that's simply not true. We've proven in studies that obesity has multiple contributing factors to it, from genetic abnormalities to hormonal derangements. How do you know if you qualify for surgery? An easy way to determine this is whether you're 100 pounds over your ideal body weight. Remember, we're not talking pounds in weight loss surgery, we're talking about body mass index. Anyone with a BMI of 40 or greater is a potential candidate for bariatric surgery. A BMI of 35 to 40 with medical conditions that are directly related to or linked to obesity are also potential candidates. Covenant's Metabolic and Bariatric Center has a free information packet that can help you determine your own body mass index. You can also calculate this online. Insurance companies have additional requirements that vary widely, but in general, they want you to reach that qualifying BMI for at least 5 years. You also must be in stable mental and physical health, and that's why everyone must go through a psychological evaluation before surgery. You must be clean from drugs for over 3 years and not abuse alcohol. Candidates must also quit smoking. You may not be a candidate if you have inflammatory bowel disease, Crohn's disease, lupus, or severe heart, liver, or lung disease. You may also be disqualified from surgery if you have abnormal anatomy of the esophagus, stomach, or intestine. Any allergies to the band material would prevent you from the band option. Some autoimmune connective tissue disorders are also an issue, and you cannot have surgery if you are pregnant or non-compliant to the doctor's recommendations. Obesity is destructive to the body. Heart disease, asthma, gastroesophageal reflux, circulatory problems, and degenerative joint disease are all linked to being overweight. Perhaps the most common issue of obesity is type 2 diabetes. High blood pressure and high cholesterol also are common. We know that cancers have been directly linked to obesity. Probably the most pronounced one is breast cancer, but we know there are others like colon and pancreatic cancer. Being overweight can also cause urinary incontinence, depression, infertility, sleep apnea, and gallbladder disease. The good news is most of these issues go away with bariatric surgery. Multiple studies have proven that you will extend your life with surgery, improving your energy, stamina, and self-well-being. 72 to 98% of heartburn is gone after bariatric surgery. 83% of our patients with type 2 diabetes find it's completely gone or easily diet controlled. That means no more medications. Your joint pain will likely be reduced 41 to 76%, and you'll get off of medications for high cholesterol. It sounds like a magical cure, but it's not. Surgery is not the easy way out. It's a tool, not a magic wand. Our surgeons can reduce the size of your stomach so you eat less, but it's still up to you to decide what gets eaten. You must change your eating habits and exercise, and you'll need to work with our team to stay on target. This isn't just until you lose the weight. This is for the rest of your life. Covenant's Metabolic and Bariatric Center specializes in minimally invasive surgery, using laparoscopic instruments that penetrate your belly through half-inch incisions. A camera guides the surgeon, and long instruments manipulate the anatomy and perform the operation. These tiny incisions mean less scars and less pain. It's a quicker recovery and a faster return to normal life. Most importantly, the laparoscopic approach has less complications. We know that laparoscopy preserves your own body's immunity, so you're better able to heal and fight off infection as opposed to the old method of opening your belly. Here are the surgeries we recommend: laparoscopic gastric bypass and the laparoscopic sleeve gastrectomy. We'll take a look at each one. Roux-en-Y gastric bypass involves stapling off the stomach and creating a small 15 to 30 milliliter pouch of stomach. The surgeon reroutes the small intestine to that small gastric pouch, so the food and calories you eat go down one limb, not mixing with the digestive juices until it meets up with the other limb. You can't eat as much, and you can't absorb as much as normal. The major advantage to the bypass is a rapid initial weight loss. It'll only take you a year to lose the weight that you need to. There are no implanted medical devices, and there's no adjustment to the band, so you'll have fewer follow-ups. This is also the procedure that reduces type 2 diabetes the quickest. Diabetes becomes 90% diet controlled. Most patients leave the hospital on no diabetic medications. High blood pressure is completely gone 60% of the time. No more medications. All other patients are on significantly less medications. Bypass basically cures heartburn because you're disconnecting the part of the stomach that makes acid from the esophagus. The acid can't get back up there. Sleep apnea patients also find relief and no longer need their machines. Anytime you operate and staple, there's a chance of leaks, and that's a serious complication. With any operation, you run the risk of infection, abscess, sepsis, and death. Let's put this in perspective for you. The mortality rate in the US after a laparoscopic Roux-en-Y gastric bypass is 0.8%. That's less than 1%, the same mortality in the US after having your gallbladder taken out. Surgery brings possible injuries to the spleen, stomach, or esophagus. You can also get ulcers. Vitamin and mineral deficiencies are normal with these procedures, and it's important that you continue to measure these levels and follow up with someone who knows about bariatric surgery. Dumping syndrome can occur, and while many patients feel this is an advantage, it must be noted. That piece of your small intestine is not used to seeing high sugar loads. So if you cheat your diet and eat that brownie, and you'll almost immediately feel it. Your heart will race and you'll feel tremors. Some patients feel faint. Most others get nauseous. Diarrhea is also likely. Most patients feel this once and never cheat again. Some are glad for dumping syndrome because it keeps you from eating another sweet. It's important to note that nausea is associated with all these operations. It's always self-limited, and it will go away. Some patients have it for a few hours, some for a few months. Nausea is helpful because it means you'll have prolonged appetite suppression. You'll be in the hospital 2 nights after gastric bypass, and you should be able to return to work in about 4 weeks. You will have to visit the bariatric center on a regular basis for vitamin and mineral monitoring, as your body won't be able to absorb them the way it used to. Supplements will become a regular regimen for you. The laparoscopic sleeve gastrectomy take 3/4 of your stomach out and make it into a tube. This connects the remainder of the gastrointestinal tract. It's important to note the section of the stomach is actually removed, so it cannot be reversed. You'll lose the needed weight in a year to 18 months. Sleeve gastrectomy is probably the operation associated with the most prolonged appetite suppression. This is because surgeons remove the part of the stomach that secretes a lot of the hormones that induce hunger. Potential complications include a leak at the staple line. Research shows that that's 1 to 2% of the time. Blood clots in the legs happen rarely. Other complications include bowel obstruction or blockage, narrowing at one of these hookup sites. It's also possible to get infections, hernias, and nausea. Surgery brings a possible injury to the spleen, stomach, or esophagus. The stomach could leak at the staple lines. This operation can induce significant heartburn and acid reflux. As you lose the weight, this usually goes away, but those with severe heartburn should keep this in mind. You can also get ulcers. No surgery is a quick fix. No matter which procedure, a bypass or sleeve, you can cheat. If you ignore the doctor's orders and eat ice cream, it's going to go right through and you'll get a ton of calories. You won't lose a pound. It's up to you to make the good food choices. Our team is here to help every step of the way, but each and every day makes a difference in how you eat and exercise. After all surgeries, you will be on a liquid diet for about 2 weeks. This will be followed by a pureed diet, progressing to soft foods to get you back on solid food. Again, no sweets, and you have to be careful with foods that can block the opening, like red meats, dry soft breads, pastas, and white rice. You'll have to chew your food well. Protein will be very important after surgery. One of the hardest behavioral modifications is that you can't eat and drink at the same time. If you eat and then drink, you'll wash the food down and lose the advantage of the small pouch. Your stomach will only hold a couple of ounces, and you must eat slowly. 15 minutes per ounce to 2 ounces. It's very important to do that after bariatric surgery to give time for the small gastric pouch and brain to keep caught up, or you will be miserable after you eat. High protein diets provide prolonged satiety or feeling full. We know if you eat protein, you eat less. Protein helps you heal and fight off infection. In women, that means 50 to 60 grams of protein a day, men in excess of 60 grams. With your smaller meals, it means protein supplementation. Carnation Instant Breakfast Drink is one, but there are dozens of these protein drinks on the market. Covenant's team is here to help you find one that's right for you. You will need to take multivitamins for the rest of your life. This is most important for gastric bypass due to the malabsorption. 10% of patients develop vitamin or mineral deficiencies after surgery. You need to take calcium and vitamin D. That's why it's essential you follow up with a bariatric center at least on a yearly basis. It's important you get advice from someone who is well-versed in bariatric surgery to help you measure your vitamin and mineral levels and supplement as necessary. We've covered a lot of information in this video, but there's so much more to learn. There are qualified websites and other information available through the Metabolic and Bariatric Center, and our experts are always open for questions. Diet and exercise are still the safest way to lose weight. Surgery certainly has its risk, but for thousands of patients here, bariatric surgery has been the answer they've been searching for. Surgery is not for everyone. You have to decide what works best for you and be committed to change. It's not the easy way out. You have to work at it, and Covenant's Metabolic and Bariatric Center is here to help you all the way.